Hello, everybody. Today I'm going to tell again in a healthy talk. I am going to tell about anxiety disorder in children. It is normal for children to feel worried and anxious from time to time, such when they start school, nursery, or moving to a new area. They can be accessed, but sometimes anxiety can affect their behavior, thoughts of every day, and interfere their school, their home, their social life. This is when you may need professional help to tackle it. So, some symptoms of anxiety in children. So, basically, signs to look out for uh, that in children are finding it hard to concentrate, not sleeping, walking in nights with bad dream, waking up repeatedly, that for bad dream or anything like that, cannot sleep properly, not eating properly, and quickly getting angry or irritable and being out of control during outburst, constantly worrying or having some negative thoughts, feeling tense and fidgety, or using the toilet often, um, crying, clingy, complaining of tummy ache, and feeling unwell. Separation anxiety is very common in younger children. However, older children and teenager tends to worry more about the school or have social anxiety. Now, how to help in these situations? This is sometime in the COVID situation also, uh, for this lockdown and thing. Anxiety is a common problem for the children. So we have to help our children. So if your child having problem with anxiety, there is plenty you can do to help them. Talk with your children about their anxiety and worries. So some also, you know, many of the childs at different age have may have anxieties that will go away after a while with your assistance. However, it's a good idea to talk with a professional and reassure yourself if child is continuously anxious. It's not getting better or getting worse. Help is not working. It's affecting their school, family life, and their friendship. Now, what to get the help for anxiety? An appointment with GP is a good place to start. You can talk with your GP on your own or with your child's, or your child may be able to have an appointment without you, whatever it is. If the GP thinks that the child could have anxiety disorder, they may refer for the assessment in local child or and young people mental health service. Specialist of mental health service focus on need of the child and young children, trained to help the children in wide range of problem, including anxiety. Um, so, if your child does not want to see a doctor, they may be able to get direct help from a local young counseling service. So more, you can visit your youth access to get the support. Now, what are the treatment? If that hampering the day-to-day practice or life. First of all, counseling. According to age and depending upon the symptoms, there are different types of support. Counseling can help your child understand what's make them anxious, and then they can work on it. There is a cognitive behavioral therapy or talking therapy that can help child to manage their anxiety by the way they are thinking and behaving. And anxiety medicine may be offered if it is very severe and it's not getting better with any other type of therapy. So it is usually prescribed by doctor who specialized on children's and young people mental health. Now, what are the causes of this anxiety disorder? Some child simply is more anxious and less capable of coping with the stress. Children can also pick up anxious behavior for around surrounding anxious people. Some children develop anxiety after stressful behavior, like frequently moving house, school, and parents if fighting or arguing, or there is some death of very close relative or friend, and become seriously ill, getting injured in an accident, school-related issues like examination or any bully, being abused or neglected. So all these things can be some of the child specific disorder like ADHD means attention deficit hyperactivity disorder or autistic spectrum disorder have associated problem of anxiety. So basically, this is the thing, a little bit of information, how you can think about it and what you can do for it. I will try giving more information in the next session. Hopefully, it will help the childs with anxiety disorder. Thanking you for listening. Bye bye.